Good evening, ladies and gentlemen, and a very warm welcome to each of you to the 27th Presidential Induction of the College of Community Physicians of Sri Lanka. It is time now for us to welcome our distinguished invitees, including our chief guest, Honorable Mahinda Yapa Abewardena, the Speaker of the Parliament of the Democratic Socialist Republic of Sri Lanka, as well as our guest of honor, Honorable Kehelia Rambukwella, the Minister of Health of the Democratic Socialist Republic of Sri Lanka, as well as our other dignitaries as they now make their way into the hall in a ceremonial procession. Ladies and gentlemen, let's rise as we welcome our dignitaries into our midst. Ladies and gentlemen, as our dignitaries have now arrived into the hall, may I request us all to please remain standing for the national anthem of Sri Lanka.
Sri Lanka, Namo, 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 Namo Mata. Sundara Sitarini, Surani Ati Sobamana Lanka. Ranya Ganaya Nikamal Valaturu Jaya Kumiya Ranya. Sapasini Setta Sadhana Jivanaye Mata Vilikanu Mena Apabhakti Puja Namo Namo Mata Appa Sri Lanka Namo 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 Mata Prema
Ladies and gentlemen, may I request that you please remain rising for a few more minutes. In our part of the world, it's customary to begin any special occasion with the lighting of the oil lamp. And in keeping in line with COVID precautions at our event, we have arranged individual candles on a tray for each of our dignitaries to use during the lamp lighting so that our dignitaries can be assured of their safety. Therefore, in keeping that in mind, to now do the honors of the traditional lighting of the lamp, may I invite the following dignitaries to please join us and help brighten up this function. We're delighted to be joined by our chief guest, the Speaker of the Parliament of the Democratic Socialist Republic of Sri Lanka, Honorable Mahinda Yapa Avivardhana. We'd also like to be joined by our guest of honor, Minister of Health of the Democratic Socialist Republic of Sri Lanka, Honorable Kehelia Rambukwella. Joined by the President of the College of Community Physicians of Sri Lanka, Dr. Lakshmi Somatunga, also Additional Secretary, Public Health Services, Ministry of Health. We'd like to be joined by the Secretary of the Ministry of Health, Dr. Sanjeeva Munasinghe. To represent the past presidents of the College of the Community Physicians of Sri Lanka, Dr. S.A.P. Gnanesara. Outgoing President of the College of Community Physicians, Dr. Nihal Abesinghe. President-elect of the College of Community Physicians of Sri Lanka, Dr. Mahendra Arnold. To represent the Fellows of the College of Community Physicians, Dr. Manuel Fernando. The World Health Organization representative to Sri Lanka, Dr. Alaka Singh. Deputy Representative of UNICEF, Ms. Emma Brigham. We have the Chief Representative of the Japan International Cooperation Agency in Sri Lanka, Mr. Yamada Tetsuya. The Chairman of the National Authority on Tobacco and Alcohol, Dr. Samadhi Rajapaksa. Secretary of the College of Community Physicians of Sri Lanka, Dr. Shiromi Madhuwage, and the Treasurer of the College of Community Physicians of Sri Lanka, Dr. Kapila Jayaratna. We warmly welcome our invitees to please come forward and brighten up this function with the traditional lighting of the oil lamp. Thank you to our dignitaries for helping us commence this event on an auspicious note. While all of you in the audience may take your seats, ladies and gentlemen, I'd like to invite the following dignitaries to take their seats on stage. We're delighted to be joined on stage by our chief guest, the Speaker of the Parliament of Sri Lanka, Honorable Mahinda Yapa Abeyewardena. We'd also like to be joined on stage by our guest of honor, Honorable Kehalia Rambukwella, our Minister of Health. We'd like to be joined on stage by Dr. Lakshmi Somatunga, President of the College of Community Physicians, outgoing President of the College of Community Physicians, Dr. Nihal Abesinghe, Secretary of the College of Community Physicians, Dr. Shiromi Madhwage, and Treasurer of the College of Community Physicians, Dr. Kapila Jayaratna. And while our officials make themselves comfortable on stage, ladies and gentlemen, at the very outset, I'd like to take this opportunity to remind all of you, before we get started with the formal proceedings this evening, let's remind you that we prioritize your health and safety. Therefore, in keeping with the public health recommendations issued due to COVID-19, we've tailored our event tonight accordingly in order to ensure that everyone is kept safe. We encourage you to please adhere to the safety precautions undertaken at the venue for our members and guests, including, of course, sanitizing your hands, wearing your masks at all times, and maintaining social distance. We hope you will appreciate these safety measures, and we thank you in advance for your cooperation with us in this regard. Well, with those safety announcements out of the way, once again, good evening, ladies and gentlemen, and a very warm welcome to each of you to the 27th Presidential Induction of the College of Community Physicians of Sri Lanka. As most of you in the audience are already aware, the College of Community Physicians of Sri Lanka, or CCPSL, is the nation's foremost professional body of public health practitioners. Its membership consists of specialists and medical officers qualified in community medicine. They work together to promote public health through a professional approach, and the college is dedicated to organizing programs on community medicine for the welfare of the people, as well as increasing awareness of the subject amongst the public. The college also strives to promote fellowship with and assist persons and institutions engaged in the practice of community medicine. Today, ladies and gentlemen, at the 27th Presidential Induction of the College, we mark yet another glorious and significant milestone in the journey of CCPSL. This evening, a new president, Dr. Lakshmi Somatunga, assumes office as she strives to set and redefine new standards of excellence for this institution. As we get started with our proceedings, we are delighted to share with all of you that our induction ceremony here tonight is going live online via Zoom, Facebook, and YouTube, providing an opportunity for our well-wishers overseas to also be a part of this ceremony. Therefore, we joyfully acknowledge all of our guests watching us online right now. We are happy to have your presence with us virtually. On that note, ladies and gentlemen, we are now delighted to commence our induction ceremony here this evening by extending a warm welcome to each of you in the gathering for giving us the gift of your presence here tonight. And now, ladies and gentlemen, to officially deliver the welcome address, please join me in inviting to the lectern the outgoing President of the College of Community Physicians of Sri Lanka. Let's put our hands together for Dr. Nihal Abesinghe.
Ayubowan. Good evening. The chief guest tonight, Honorable Speaker of the Parliament of Sri Lanka, Mr. Mahinda Yapa Abeyewardena. The guest of honor, Honorable Minister of Health, Mr. Kehalia Rambukwella. The newly elected President of this CCPSL, Dr. Lakshmi Somatunga, and the office bearers, the council members of the CCPSL, past presidents, and fellows of the college, distinguished guests, ladies and gentlemen. It is a true pleasure for me to welcome you to the induction of the 27th Presidents of the College of Community Physicians of Sri Lanka here at Hilton, Colombo. I am sure there will be hundreds of people around the world and from Sri Lanka watching this event via Zoom, through CCPSL Facebook page and the CCPSL YouTube channel. I warmly welcome all of you to this induction ceremony. I am honored as the immediate past president of the CCPSL to welcome the past presidents, fellows, the council members, and the members of the College of Community Physicians of Sri Lanka to this important annual event. I also would like to greet the representatives from the professional colleges, the Ministry of Health, and other government officials and colleagues from non-governmental agencies. It is also an honor for me to welcome the representatives from our partner organization, the World Health Organization, UNICEF, World Bank, JICA, and others to this occasion. Dear Excellencies, ladies and gentlemen, public health or community medicine is the science and art of preventing disease, prolonging life, and promoting health through the organized efforts and informed choices of society, organizations, public and private communities and individuals. Overall, public health is concerned with protecting the health of entire populations. These populations can be small as a local neighborhood or as big as an entire country or region of the world. As such, the community physicians, the public health professionals of Sri Lanka, try to prevent health problems from happening or recurring through implementing educational programs, recommending policies, administering services, and conducting research and surveillance for which they use their knowledge and skills to improve the quality of life of everyone. In contrast to clinical professionals like hospital doctors and nurses, focus primarily on treating individuals after they become sick or injured. Public health attempts to limit health disparities. A large part of public health is promoting health care, equity, equality, and accessibility, leaving no one behind, and through which we try to achieve universal health coverage. The first professional association of public health officers in Sri Lanka was the Society of Medical Officers of Health, established on 26 November 1927. In 1960, the society changed its name to the Ceylon Public Health Association. In 1994, the members unanimously adopted a resolution to convert the association to a college. As a result, the college was established in 1995. It was named the College of Community Physicians of Sri Lanka. Late Professor Lulitha Fernandu was the first president. The initial membership was 180. Now we have more than 600 members in the college island-wide. In my opinion, community physicians are well geared to play any role in any field as independent advisors to policymakers through evidence generation and even to grassroots level in prevention of disease, health problems, and promotion of health. This is what makes our college unique among the rest. Being the oldest and largest, the College of Community Physicians plays a significant role in public health and related fields with other stakeholders. Therefore, it is no doubt that it's an outstanding achievement in one's career that she be elected as the president of such an important professional body. I have known Dr. Lakshmi Somatunga very well for a long period as a fellow public health physician and as the chief MOH Kurunagala, later at the anti-leprosy campaign and during the last 2 decades as a senior official at the Ministry of Health at various positions, now as the Additional Secretary Public Health Services. I sincerely believe that you deserve, Madam, to be the president of this prestigious college. I wish you all the best, the 27th president, and the Council for the year 2021-2022, and I am sure you will lead the CCPSL to achieve its objectives and provide the necessary guidance for improving the public health services of the country. Once again, let me warmly welcome all who have gathered here in this lovely evening, adhering to all the public health measures and setting an examples to the country to the induction ceremony of the 27th President of the College of Community Physicians of Sri Lanka. Thank you very much.
Thank you very much, Dr. Nihal Abesinghe, for warmly welcoming the audience as well as giving us an insightful overview into the importance of public health in our communities and the importance of an organization such as CCPSL. Ladies and gentlemen, this evening we will be witnessing the induction of Dr. Lakshmi Somatunga as the 27th President of the College of Community Physicians of Sri Lanka to now officially induct the new President. May I once again invite the outgoing President of the College of Community Physicians of Sri Lanka, Dr. Nihal Abesinghe, to do the honours.
Thank you very much. And this is the citation for the 27th President of College of Community Physicians of Sri Lanka, Dr. Lakshmi C. Somatunga. Dr. Talgahena Lakshmi Chiramani Somatunga, holding the post of Additional Secretary Public Health Services of Ministry of Health, was born on 23rd of July 1962. She is past pupil of Devi Balika Vidyalaya, Colombo. Having entered the Faculty of Medicine, University of Sofia, through a scholarship from University Grants Commission, she graduated in 1988 with MBBS. She obtained MSc Community Medicine and MD Community Medicine in 1994 and 1999, respectively, from the Postgraduate Institute of Medicine, Colombo. Soon after, she joined master course in leprosy research in Tokyo, Japan, where she explored the disease progression of leprosy at cellular level and returned to Sri Lanka in December year 2000. After serving in the curative sector as a medical officer, she started her public health career as the medical officer of health Polpitigama in Northwestern Province, followed by Regional Training Center in Kurunegala, and then worked at the anti-leprosy campaign. She started her administrative career in 2001 as the Director Non-Communicable Diseases and then served as the Director Mental Health. In 2012, she was appointed to the position of Deputy Director General Medical Services, being the first lady to hold the position, and in 2018 she was appointed to her current position of Additional Secretary Public Health Services, which is the highest most public health post in the Ministry of Health. During her career, she pioneered in taking vital steps in improving public health. To name a few such as appointing dedicated focal point medical officers in district level to coordinate non-communicable diseases and mental health, and pioneering to establish healthy lifestyle centers. Also, she was instrumental in bringing Tobacco Control Act and making Sri Lanka as a pioneer in the ratification of Framework Convention on Tobacco Control in Asia, bringing the country to the global level. Dr. Somatunga has a vast international exposure. She is trained in health diplomacy at Graduate Institute of Geneva and in health accreditation at Australian Council on Healthcare Standard, for which she is an international assessor. She has been representing Sri Lanka for Commonwealth for past 4 years and served as the Vice Chair and immediate past Chairperson of Commonwealth Advisory Committee on Health. While authored many research papers on leprosy situation, tobacco use, alcohol use, injury control, and healthcare quality, Dr. Somatunga has represented the country at many international fora and non-communicable diseases, injury control, mental health, and intergovernmental negotiations on public health treaty. She served as a member of expert groups at World Health Organization for Tobacco Control. Also, she served as a resource person for international conferences on non-communicable diseases, surveillance, and healthy lifestyle. She is the fellow of the College of Community Physicians of Sri Lanka. Ladies and gentlemen, it is my pleasure and honor to read the citation of Dr. Talgaha Hena Lakshmi Chiramani Somatunga for the induction as the 27th President of the prestigious College of Community Physicians of Sri Lanka.
Thank you very much, Dr. Nihal Abhay Singha, for officially introducing our new president to the audience. Friends, to now formally induct the new president, we will be witnessing the awarding of the Presidential Medal to the new president of the College of Community Physicians of Sri Lanka. Dr. Lakshmi Somatunga, the Presidential Medal will be awarded by past President Dr. Nihal Abhay Singha. Friends, can we now please put our hands together as Dr. Lakshmi Somatunga officially assumes office as the 27th President of the College of Community Physicians of Sri Lanka. There we have it. Come on, ladies and gentlemen. A loud round of applause for our new President. We will now also witness the awarding of the past President's Medal to the past President, Dr. Nihal Abhay Singha. This medal will be presented by our current President, Dr. Lakshmi Somatunga. Ladies and gentlemen, please put your hands together for Dr. Nihal Abhay Singha, as we thank you for a wonderful past year of service under his leadership as President. On that note, thank you once again to Dr. Nihal Abhay Singha for his dedication and contribution to the college in his term of presidency, while at the same time, I'm sure you all join me in congratulating and wishing the very best to our new President, Dr. Lakshmi Somatunga, for a year of great success to follow. Ladies and gentlemen, today, on the occasion of our 27th presidential induction, a distinguished invitee who has enriched our gathering here this evening with her presence is the World Health Organization representative to Sri Lanka, Dr. Alaka Singh. It's now my honor to introduce her to you. Dr. Alaka Singh assumed the responsibilities of the WHO representative to Sri Lanka in May 2021. An Indian national, Dr. Alaka Singh has worked in health and development for over 2 decades. With the WHO, she has held positions at all 3 levels of the organization, supporting countries in Southeast Asia as well as the African and Eastern Mediterranean regions. Her technical experience has been focused on health systems, primary health care, and universal health coverage. Dr. Alaka Singh has an educational background in economics and development with a first degree from the Delhi University and advanced degrees from the College of William and Mary, Virginia, USA, and Cambridge University, UK. Ladies and gentlemen, to now address the gathering, let's welcome on stage Dr. Alaka Singh.
Ayubowan. Good evening, distinguished guests, Speaker of Parliament, Honourable Minister, senior officials from the Ministry of Health and the College of Community Physicians. Thank you very much indeed for inviting WHO to this event. We have a long-standing partnership with the College of Community Physicians, Sri Lanka, and I'm particularly glad to be here to congratulate Dr. Lakshmi Somanathan, the newly inducted 27th President of the College. Since I joined WHO Country Office in May, I have been most impressed by Dr. Lakshmi Somanathan's devoted and energetic and patient patience in securing vaccines for Sri Lanka through the COVAX facility. This is the area that we've worked together most, and it's been really impressive and an honor to have worked with her. WHO now looks forward to working with Dr. Somanathan as president of the college on COVID-19 recovery through her chosen focus on reliance in public health towards in the post-COVID era. As it happens, just this afternoon, we concluded a high-level launch of WHO's position paper on building health systems resilience towards UHC and health security during COVID-19 and beyond. Honorable Minister for Health, Sri Lanka represented our region, the Southeast Asia region, at the event. And he used the COVID-19 experience in Sri Lanka to share lessons learned for operationalizing and building back health systems with resilience. As Honorable Minister reminded the global audience, Sri Lanka's health system has been anchored in public health since 1926 and was, in fact, a contributing case study to the Alma Ata Declaration on Primary Healthcare in 1976. Importantly, from the very beginning, Sri Lanka has relied on domestic resources for sustainable and equitable health for all. This includes both a well-trained workforce from community level upwards through higher levels of care, as well as adequate public financing for a fully subsidized healthcare system available free of cost. This is the strong foundation based on which Sri Lanka has achieved notable success in health indicators, which are actually above its income group and in fact compare very well with those of developed countries. And this PHC Foundation has been a key contributor to resilience during COVID-19. The pandemic has tested the health system to the limit across the world. As Honorable Minister highlighted at the meeting, 3 key lessons have emerged from Sri Lanka's experience. First, the need to re-examine service organizations to be more responsive and the potential of digital health innovations to support this. Second, a whole of government and whole of society approach. Honorable Minister shared the example of the home care management program that was very quickly and effectively implemented in Sri Lanka to take the pressure of hospitals during the 3rd COVID wave. With the caseload now significantly reduced, the program is being considered for application to non-COVID services, notably NCDs. And the electronic vaccine tracker developed for the successful vaccination effort is now being adapted for monitoring long COVID and NCD services. It's worth noting here that Sri Lanka has supported Timor-Leste in adopting the vaccine tracker as well. Third, and finally, access to vaccines during COVID-19 has underscored the importance of strengthening global health governance to safeguard equity and sustainable financing for health. The Sri Lanka COVID-19 experience and Dr. Somatunga's vision for recovery resonates very well with the WHO recommendations for resilience going forward. Recover and transform health systems with investment in essential public health functions and the foundation of health systems with a focus on primary health care. All hazards emergency risk management to ensure and accelerate sustainable implementation of the international health regulation and a whole of government approach to secure community engagement and whole of society involvement. To support this, WHO shall be establishing a regional platform in Sri Lanka to exchange knowledge and practical experiences, as well as build country capacities for PHC-centered resilient health systems. Please allow me once again to congratulate the President and thank the College of Community Physicians for inviting WHO. WHO looks forward to strengthening our collaboration under your leadership, Dr. Lakshmi, and working together towards our common goals. Thank you.
Thank you very much, Dr. Alaka Singh, for representing the WHO at our ceremony and also for your words of commendation to Sri Lanka, especially in light of the COVID-19 pandemic. Ladies and gentlemen, this evening we are also privileged to be joined by our guest of honor, Honorable Kehlia Rambukwella, the Minister of Health of the Democratic Socialist Republic of Sri Lanka. May I officially introduce our guest of honor to you. Honorable Kehlia Rambukwella was born in Kandy and received his education at St. Thomas's College, Gurutalava and Mount Lavinia. He pursued his postgraduate studies at the University of Salzburg, Switzerland, reading International Hospitality. The Honorable Minister's political career began in 1992. Before being appointed as the Minister of Health, he has held many portfolios such as Minister of Science and Technology, Minister for Planning and Implementation, and Minister of Mass Media and Information. Honorable Kehlia Rambukwella closes in on 3 decades of political service. With that introduction, we now have the privilege of listening to the esteemed thoughts of our Honorable Minister on this occasion. Ladies and gentlemen, let's welcome Honorable Kehlia Rambukwella.
The Honourable Speaker of the Parliament of Democratic Socialist Republic of Sri Lanka, WHO Representative in Sri Lanka, Dr. Alaka Singh, Chief Representative of JICA, Deputy Representative of UNICEF to Sri Lanka, Chairman National Authority on Tobacco and Alcohol, the President and the Council of the College of Community Physicians of Sri Lanka, Secretary and all health ministry officials, distinguished invitees, ladies and gentlemen. It is my pleasure to join you here to induct this 27th President of this prestige college, Dr. Lakshmi Somatunga. Dr. Somatunga, who is no stranger to me, as also happens to be the Additional Secretary at the Ministry of Health. I wish her all the very best as she steps into a new role. Congratulations. Let me begin by appreciating all our public health professionals whose sacrifices, hard work, skills have contributed to Sri Lankan health sector, been a highly recognized and talked about sector worldwide. The battle against the current COVID-19 pandemic has only reinforced the resilience of the health sector of Sri Lanka. Decades of determination, steadfastness, and fortitude of Sri Lanka's public health service workers have contributed to the pinnacle growth achieved today. Sri Lanka's success in combating COVID-19 and its ability to adjust to the ever-changing local and global situations during the pandemic has been testimony to the adaptability of our health sector and has drawn the attention of the world to this success achieved. Your task as a professional College of Community Physicians is enormous, ensuring your members receive the necessary training and guidance for capacity building, sharing best practices, skills development, professional development, which will ensure the progress and maintenance of the ability of health care provided in Sri Lanka. I note with pleasure the achievements attained by our Sri Lankan healthcare professionals, even on the global stage. Many Sri Lankan healthcare professionals are part of organizations such as the United Nations, WHO, and other such international organizations. Their training work, ethic, and professionalism have earned them a place in global organizations amidst fierce competition. A testament to the caliber of healthcare workers produced in Sri Lanka. As Sri Lanka gradually reopens the country, adapting to the new normal and going about its daily work, I commend the College of Community Physicians for organizing this event, adhering to all COVID-19 guidelines and regulations. My sincere gratitude goes to the President and the Organizational Committee for tirelessly contributing made during this ongoing crisis. I look forward to collaborating with the President and her team to further enhance measures already taken by the authorities to better streamline and improve processes. Once again, I congratulate Dr. Lakshmi Somatunga on her induction and wish her and the College of Community Physicians the very best in all future endeavors. I look forward to collaborating and partnering up with you on future health sector related projects. All the very best, and thank you so much.
Thank you very much, Honorable Kehelia Rambokwela, for your presence here this evening, as well as for your very warm words appreciating the sacrifice and skills of the public health professionals here in Sri Lanka. Ladies and gentlemen, we are deeply privileged this evening to be joined by our chief guest, Honorable Mahinda Yapa Abewardena, the Speaker of the Parliament of the Democratic Socialist Republic of Sri Lanka. Please allow me now to officially introduce our chief guest to you. Having entered the Parliament in 1983, Honorable Mahinda Yapa Abewardena is a veteran politician serving for more than 35 years. He served 2 terms as the Chief Minister of the Southern Province before entering the Parliament. During these terms, he has been influential in developing the infrastructure of the Southern Province. He has also held a number of ministries such as Health, Cultural Affairs and National Heritage, Irrigation and Rural Development, Industry and Commerce, Parliamentary Affairs and Agriculture. He was also one of the Vice Chairmen of the Sri Lanka Freedom Party. With that introduction, it's now our honor to listen to our chief guest address the gathering as he shares his message with us here this evening. Ladies and gentlemen, let's now welcome our chief guest, Honorable Mahinda Yapa Abewardena.
Honorable Minister of Health, Honorable State Minister of State Minister of Pharmaceutical Production, Supply and Regulation. I hope that you are not attended today. WHO representatives of Sri Lanka, Deputy Representative of UNICEF to Sri Lanka, Chairman National Authority on Tobacco and Alcohol, the President and the Council of College of Community Physicians in Sri Lanka, Secretary and all Health Ministry officials, distinguished invitees, ladies and gentlemen. Giving due honor to the invitation, I am very pleased to be here for the induction of 27th President of the College of Community Physicians of Sri Lanka. It is encouraging to observe that this event, which is routine activity of the college, it is every year, is being conducted despite COVID-19 situation, adhering to the health safety measures. My sincere appreciation goes to the President of the organizing committee for conducting the event with precautions. Sri Lanka is performing well in public health services with great contribution by the community physicians. It is highly impressive to see
that the Sri Lanka's public health indicators are leading in the South Asia region, and some of the indicators are in par with developed countries. I take this opportunity to appreciate all the work done by the public health staff, including primary and primary care level medical officers of health under the technical guidance of specialty community medicine. One of the key policies of the Ministry of Health under the vistas of prosperity and splendor of His Excellency President is health first concept with an objective to change the approach to promoting the lifestyle instead of treating a patient. The quality of health system in a country is reflective in its preventive services, where public health matters the most. I am aware that we have an excellent ground level public health system in operation since 1926 in the country. It has been recognized at the global level as one of the best organized and structured systems in this part of the world. You have selected this specialty, giving due consideration to the fact that prevention is better than cure. Nobody wants to be ill, and even a king becomes helpless when he is ill. In the world of having many risk factors like tobacco, unhealthy food, and sedentary life, you have a difficult task of making people aware of the dangers and to help with behavioral changes. Also, with your support, we are going forward with disease elimination program, just to mention few such as polio elimination, measles elimination, malaria elimination, and so forth. I understand that it is equally difficult to maintain the elimination status of disease once the elimination is achieved, as neighbor countries still have the same disease. Your continued effort had made country proud, and I hope that with the professional activities of this prestigious college, we can further strengthen and achieve many more milestones. Talking about new president of Dr. Lakshmi Somatunga, who held many important positions in the health ministry as director, non-communicable diseases, mental health, and also deputy director, general medical services, and now additional secretary of public health, has a vast experience in the subject, and I am confident that she will confidently steer the college in a good direction and in an efficient manner. I congratulate Dr. Lakshmi Somatunga for the presidency, and I wish her and new council a fruitful year and effective outcome during this tenure of office theirs. Thank you very much.
Thank you very much, Honorable Mahinda Yapa Abewardena, for sharing your thoughts with us. We are deeply honored by your participation and presence here this evening. Ladies and gentlemen, at the College of Community Physicians of Sri Lanka, with every new president that assumes office each year, we also have a new logo and a theme unveiled for their term that highlights the vision of the president's tenure. We're delighted to now announce the launch of the logo and theme under the presidency of Dr. Lakshmi Somatunga. And as you will see, this logo consists of many squares, with each square carrying its own special significance and meaning. So without further ado, ladies and gentlemen, let's now take a look at the logo and theme for the presidential term of 2021-2022. Take a look. And there we have it, ladies and gentlemen, the official logo and theme for this presidential year, that is Public Health for Resilience. And I'm sure all of you agree, ladies and gentlemen, this is a very apt theme for these turbulent and testing times. Resilience is indeed the need for the hour, and I'm sure resilience is going to be the keyword in everybody's minds this year moving ahead. On that note, friends, on this occasion of the 27th presidential induction, it's now our privilege to hear from the newly inducted president of the College of Community Physicians of Sri Lanka as she shares with us her vision for the college during her tenure. Ladies and gentlemen, it's now my honor to welcome the 27th president of the College of Community Physicians of Sri Lanka. Ladies and gentlemen, please put your hands together for Dr. Lakshmi Somatunga.
Ayubowan. Good evening. Honorable Speaker of the Parliament of Democratic Socialist Republic of Sri Lanka, Honorable Mahindeyapa Abewadana, Honorable Minister of Health, Honorable Keheliya Rambukalla, the Council, past Presidents and Fellows of the College of Community Physicians of Sri Lanka, Dr. Alaka Singh, WHO Representative to Sri Lanka, Yamada Tetsuasan, Chief Representative of JICA, Mrs. Emma Brigham, Deputy Representative of UNICEF to Sri Lanka, Dr. Samadhi Rajapaksha, Chairman, National Authority on Tobacco and Alcohol, Dr. Sanjeeva Munasinghe, our Secretary, Minister of Health, and all health officials, distinguished invitees, also all those who join via Zoom from Sri Lanka and other parts of the world, ladies and gentlemen. Although not the first in human history, it seems that COVID-19 will leave its legacy and consequences on us. Sooner or later, depending on the behavior of the virus and its mutations, and most importantly, how people adhere to the universal precautions of breaking the transmission cycle of COVID-19, we need to cope up with the problem and be a part of global efforts to come out of the situation. When the world is facing a global pandemic, our main responsibility is to provide public health response in a scientific and evidence-based manner. The COVID-19 pandemic has led to a dramatic loss of human lives worldwide. People who have died with COVID-19 have an average lost about 10 years of life. Though COVID-19 has rapidly affected our day-to-day life, businesses, disrupted the world trade and movements, and most importantly, the greatest asset as mentioned by Lord Buddha, the health of the people. It is of utmost importance that we need to get back on track. In order to go forward, what is needed is resilient health system. We, as community physicians, it is our prime duty to contribute to promote resilient health system in the face of COVID-19 challenge. Hence, supporting the health system to be resilient is more relevant than ever. That is why I could not think of a better or more appropriate theme for my tenure as the president of this prestigious college. Resilience, in simple words, denotes capacity to recover quickly from a difficult situation. There are three key processes of resilience: absorption, adaptation, and transformation. We need to prepare well that the health system to absorb some shocks or minimum changes or redistribution of resources. Then the system needs to adapt through reallocation of resources and relevant changes to policies and procedures. Then we need to be innovative to transform the health system, providing appropriate services which is practical and easy to regain. Let us see the principles of health system resilience in the context of COVID-19 response. These are the 7 key principles. Let me take one by one, very short. First, develop flexible pathways for medical supplies. Whether it's a pandemic or natural disaster, a resilient health system secures continuity of provision of medical supply. This may involve developing flexibility in the procurement system and priorities like enhancing buffer stocks. Prioritize a list of essential health services is another principle. It is vital that we prioritize most essential services, adapting the system to manage the risk of COVID and consequences of COVID-19. We should anticipate that we need to adjust priorities as needs evolve over time. Example, mental health services as a result of fear, loss, and isolation. An able system ensures that all priority services are free at the point of use for vulnerable population groups. Build trust with local communities. Trust between communities and the health system emerges as a crucial resource. Different health messages, problems in the sequence of messaging may have confused the public. We need to rebuild the trust and confidence our public has placed on the public health services. Utilizing the excellent primary health care infrastructure in Sri Lanka, we can do it. I emphasize that we need to be sincere and transparent with the people. Foster good communication at all system level. Crises are a time of confusion, threat, insecurity, and often misinformation for staff and to the public. It is essential to strengthen the communication between different sectors of the health system, including linkages between curative and preventive health sector. Then comes to support, recognize, and encourage staff. We have a dedicated staff and they can make a significant difference to health systems, absorptive, adaptive, and transformative capacities. As much as possible, staff actions and achievements in challenging circumstances should be recognized and rewarded. Ensure tracking of health information. All health systems need to ensure that all key data are collected, monitored, and use it for the evaluation and prediction and towards betterment of the nation's health. Innovation in how data is gathered and shared is important, but often not happening. All countries must have the necessary capacity and resources to accurately collect data. Surveillance is a backbone of an effective response. The COVID-19 pandemic has shown the importance of data and science to build back more resilient health systems. The last key principle, cultivate effective partnership and networks. No sector can manage all needs on its own. And especially in a crisis, resilient systems create, reinforce, and operate on networks and encourage complementary actions. For example, from development partners, civil societies, local leaders, the private sector, and community groups. Collaborating across sectors within or across countries is critical to effective response. Remember, ladies and gentlemen, this is a pandemic, and with coordinated global action only, we can achieve comprehensive and effective outcomes. In summary, I want to highlight that why resilience is important. It maintains core functions during a crisis. It protects human life, produces good health outcomes, minimizes social and economic disruption, as it is based on research and experience in health and other fields. It will benefit from further testing and refinement. It demonstrates the capacity to adapt in normal times. We, as a college, whose members are with public health qualifications, is determined to support building a resilient health system in our country. Honorable Speaker and Honorable Minister, this is a specialty of health professionals who work very hard, silently providing services with much dedication. I am confident that with my talented council and all the members, we will work for a sustainable program on the theme during our tenure. When assuming this prestigious presidency, keeping with the tradition, it is my pleasure to offer my gratefulness at least to few people and places that have refined my humble journey so far. First, I am grateful to my parents for my solid foundation. And I am deeply indebted to my alma mater. First to Pannipitiya Dharmapala Vidyalaya, where I spent my primary education up to grade 5, and then from grade 6 until I entered to the medical college, Devi Balika Vidyalaya at Colombo 8, for molding me with rich values and morals. Next, to all my teachers from kindergarten, school, medical school, postgraduate institutes, and all my mentors for refining me to the person who I am today. I am grateful to the exposure I gained from Sophia Medical Academy, Postgraduate Institute of Colombo, Leprosy Research Center, Tokyo, Graduate Institute of Geneva, Australian Commission on Healthcare Standards, Sydney, where I have been refined and gaining so much courage and many skills and capabilities, and in accumulation led to the feeling of confidence in every step of my professional life. My family has been the wind beneath my wings always. Though there will be a formal vote of thanks, it's my duty to mention my gratitude to Honorable Speaker and our own Minister of Health for accepting our invitation and for gracing the occasion. The presence of all development partners and Chairman Nata also is greatly appreciated. I appreciate all those who are joined via Zoom, and I thank every one of you for your presence here today, carefully selected to grace this occasion due to COVID-19 situation. My council members, past presidents, fellows of the college, my students, colleagues, my relatives, in-laws, and my staff members for providing strength to me to make this milestone in my professional life a memorable one. I wish you a pleasant evening. Thank you.
Thank you very much, Dr. Lakshmi Somatunga, for your inaugural address as President, highlighting for each of us your vision for the college to promote resilience in the healthcare sector in Sri Lanka. And of course, I'm sure everybody here joins in wishing you all the best with your initiatives as you propel the college forward towards new heights as President. Ladies and gentlemen, we're almost drawing close to the end of the formal proceedings, but before that, we have to remember the success of this induction ceremony would not have been possible without many individuals coming together to make this a memorable event. We'd now like to take this opportunity to offer our heartfelt gratitude to each of the contributors who made their mark on our ceremony here tonight. To sum up all of our appreciation in a vote of thanks, please join me in welcoming the Secretary of the College of Community Physicians of Sri Lanka. Let's put our hands together for Dr. Shiromi Madhuvage.
Good evening. Our chief guest tonight, the Speaker of the Parliament of the Democratic Socialist Republic of Sri Lanka, Honorable Mahinda Abeyewardene. Guest of Honor, Minister of Health, Honorable Keheliya Rambukala. President and the Council members of the College of Community Physicians of Sri Lanka, past presidents, fellows of the College of Community Physicians of Sri Lanka, Secretary, Ministry of Health, and all the officials from the Ministry of Health, representatives from WHO, JICA, UNICEF, World Bank, and all other donor agencies, Chairman of the National Authority of Tobacco and Alcohol, academia, representatives of other professional colleges, distinguished guests, ladies and gentlemen. I am honored to deliver the vote of thanks as the Secretary of the College of Community Physicians of Sri Lanka at this memorable event. Our chief guest, Honorable Mahinda Abeyewardene, the Speaker of the Parliament, the guest of honor, Honorable Keheliya Rambukala, Minister of Health. Sir, we highly value your presence today to witness this event. And President, Council members, past presidents, fellows, all the members of the College of Community Physicians of Sri Lanka, you are the strength of pillars of the College of Community Physicians of Sri Lanka. Thank you very much for extending your immense support to make this event a success. Secretary, Ministry of Health, Dr. Sanjeeva Munasinghe, and all the Ministry of Health officials, we extend our gratitude for being with us to grace this occasion. Chairman of the National Authority of Tobacco and Alcohol, Dr. Samadhi Rajapaksa, representatives of WHO, UNICEF, JICA, all other donor agencies, academia, thank you for extending your immense support and being with us today. A special word of appreciation to Dr. Rangana and Dr. Maya Kadua for taking all the burden on to your shoulder in organizing this event. Dr. Isenka Talagala, Assistant Secretary of the College of Community Physicians Sri Lanka, and the members of the Management Subcommittee of the College of Community Physicians of Sri Lanka, and Dr. Shashiprabha Navaratna, and Dr. Chiara Pereira, thank you for your assistance extended in organizing this event. And our college assistant, Mr. Angelo Ravindran, thank you, Mr. Angelo, for your continuous support. We highly value the support extended by our AV crew, hotel management, and our compere tonight, Mrs. Trishma Pinto. Thank you very much. And last but not least, all invitees who joined with us physically and virtually, thank you for being with us irrespective of your busy schedules. We invite all of you for the fellowship and strictly adhering to the health guidelines. Thank you.
Thank you very much, Dr. Shiromi, for those warm words of gratitude expressed to everybody involved in making tonight a very delightful event indeed. With that, ladies and gentlemen, we now draw the curtains on our 27th presidential induction of the College of Community Physicians of Sri Lanka. It's our pleasure to invite you to join us shortly for dinner, of course, in keeping with the prevailing health and safety guidelines. I'd like to take this opportunity to encourage you to please keep in mind the following precautions. While you serve yourselves dinner at the buffet counter, we'd like to request you to please keep your masks on. And of course, we request you to continue to maintain social distance through the rest of the evening. We'd also like to draw your attention to the 3 envelopes that are placed on your tables. These envelopes are being placed there so that while you're eating, you can keep your masks in that envelope and keep them safe and clean. All right, ladies and gentlemen, with those safety precautions reminded yet again, we are now ready to wrap up our formal proceedings here tonight. Once again, we thank you for your participation with us here this evening, both to our invitees who are here physically present in person and to all of our well-wishers who are joining us online from across the world. Thank you for enriching our ceremony with your presence. On that note, as we now come to the end of our formal proceedings, may I request us all to please rise as our dignitaries leave the hall in a ceremonial procession. And with that, ladies and gentlemen, thank you once again for your presence here. We wish you a wonderful evening ahead. Please enjoy dinner. Bon appetit and good night.